Hey, thanks for joining us. You're going to want to stay tuned because we have 25 minutes with the former county commissioner, Jean Monestime. Thank you very much for being here.
Thank you, Michael, for allowing me to be here.
And you were on the commission for 12 years. That is, in today's words, that is a whole lot of time.
That was an eternity.
Well, that's one way to put it. But you got elected, a whole bunch of times. That's a big deal.
That's a big deal for a former refugee in this country.
Yes.
Right? I know there's some in Washington don't like us nowadays, but we're here to stay.
And a couple of years ago, my brother Brandon and I said, we need to have more representation, people of Miami. We want them, and when I say Miami, generic throughout the county, we want people on our show to represent Miami. Yeah. And there was one group that was not there, which we finally got, which was Haitian Americans.
Yes.
And my heart hurts to think that some of those folks that we met through this process may not be here. And it's just, the people that are here in Miami, that's what makes this town so great, right?
Wow. Look, I'm a product of this community, and I've been so blessed by this community. I think, Michael, you remember my story. I came here as a 17-year-old. I had nothing. I came here alone. My parents were not here. My dad was not here. My mom was not here. And I didn't have a rich uncle, rich aunt to support me. I was welcomed by a church that supported me. Okay, they encouraged me to stay out of trouble and go to school. And here I am talking.
What was it like, 17 years old, and you're here by yourself?
By myself.
Oh, my goodness.
I had a sister here, but she had been here 2 months prior.
and no mentors, no adults in your life? And
except for the members of the church that that became my home church after I arrived here as a 17-year-old. They became my
What church was that?
That was Eden in Little Haiti. And I'm still a member of the same church.
Yes.
Because you got to be loyal to those who've been loyal to you.
Yes.
So they encouraged me, and I became the first person from that church to graduate college. Okay.
Congratulations.
Yeah. So I became the second person to finish grad school. Okay. So it's a story, and that's the American story.
Tell me what was
alone, but that's the American.
So what was in you when you wound up here? It was destined that those things were going to happen. It wasn't one day you said, "Gee, I'm going to go to graduate school." There was something inside that pushed you to that.
Well, look, we all were thinking that coming here is just to look for better opportunity in life. Okay, and of course, I never thought I'd ended up in this career and this ministry that I have, I call it. So I wanted to finish school, honestly, and have a career, okay, and have the American dream, okay. So which is buy a home, have a decent family, with a nice car, and that would be it. But I later on realized that I need to pay it back. I'm too blessed to sit around and enjoy what this community has given me. I had to pay it back, and that's why people reach out to me and ask me to run for office to represent them, because my business was doing that. I was a real estate broker, assisting people with homeownership in my community, and after saying no so many times, I decided, okay, I need to answer the call, and I never regretted it. I don't regret it at all.
So we have some little history. So we have today's stuff that you're doing, but tell us about today and tomorrow. What are you doing, and what do you want to do?
Today, after the Honorable Congresswoman Frederica Wilson announced her retirement, which has been now 3.5 weeks ago, I decided to join that race to represent the community in Congress in District 24. So now I'm running for Congressional District 24.
Congratulations.
To represent South Florida. Yeah.
So we met a couple of years ago, and a friend of mine, Ernie Thomas, went to graduate school with you.
Yeah, he went to grad school with me.
Yeah. Ernie, hello there. All right.
Ernie, good people.
Yes.
Good people.
So when that seat opened up, and how long was she in office?
She was in office for 16 years.
16.
But she's a household name, and she's been leading in the community for more than 40
Does she wear this thing around her head?
Yeah, a hat.
A hat.
Yeah.
So, folks, if you don't know who she is, she's that lady up north who wears the hat. All right, and it's a wonderful thing when you see her, and she really served the community really very well.
Very well.
Right?
Yeah.
And we were honored to have her in our community.
Yeah.
So let's say you get an office and you can push some magic button, and that being up there is a little bit different than being here. Here you were one of 13.
Yes.
And it might have been, I don't know if it's easier to be a commissioner, or it's going to be easier doing that. But if you could push a magic button or a couple of them, what were some of the things you'd like to bring back home?
What I'd like to bring back home is ensuring that my community is more economically mobile, providing resources which allows people to be more independent financially. That's what that means. Second, I'd like to work on issue that allows my community to have access to healthcare. Okay, in a great country like this, healthcare has to be affordable. It has to be accessible. We need affordable housing, but we also need attainable housing. What's affordable today may not be attainable because of inflation and the economy.
And I think that's an important thing. When people say affordable, everybody sort of giggles. I said, that's just a legal description of it.
Yeah.
Because it's not affordable.
Yeah.
So attainable is probably more appropriate for wherever it is in the country, but specifically here. And I see all these new apartment buildings that are going up, and it took a while for it, but thousands of units of apartments. Yeah. And I don't know, again, what affordable is, but it's out of sight. I certainly don't know what the answer is.
Whenever you're paying upward 40%, 45% of your income to pay rent or to pay debt service on your mortgage, that's not quite affordable. But it's not to the fault of the people that build this unit. Yeah. It's the economy stupid.
Yeah. So when the young people are out there, and I want them to understand what that means. So if you were making $10,000 a month, after taxes, let's say it's $8,500, $9,000. You're going to take a huge part of that just to pay you for the roof.
Yeah.
All right? That is gigantic. So all of a sudden I'm feeling pretty rich, like I'm taking care of myself. All of a sudden you go like this, okay, take out a whole bunch more for your car. Yeah. Oh, we got that food thing, right? And then you have the household expenses. Yeah. And then when you have children, all of a sudden you're not making enough because you can't. And so it's a challenge. That's one of the things that we hear all the time. How can we afford this?
Yeah, the thing for me, I understand very clearly what individuals and working family are going through in this community, because I'm one of them. Okay, I remember when I had my first child, I probably was paying about $50, $60 a week for childcare. Now people are paying, between $800 to $1,500 a month. In middle-income community, I'm not talking about in wealthy community, middle-income community. So unless you have two parents making at least $75,000 a year each, or $80,000 a year each, they're not able to make ends meet.
When we had little kids, I told my wife, I said, you could go out and get a job, and then what we're going to do is we're going to take almost all of that to pay for their care. Yeah. I said, so let's make it so you're going to stay at home. You're going to take care of them. All right. So you can be with them. All right. And I'll try to figure out the rest. And so we know that it's hard. Let's talk a little bit about healthcare. Mm-hmm. It's a gigantic thing. I used to be a registered nurse a long time ago. And so, yeah, thank you.
You're doing God's work.
Yes. And I felt like that so often when I could be able to help people. And in Miami, poor people, all right, in and of themselves, because they don't have as much access or afraid to access it, or they don't have the support access, or maybe there aren't, in any families, maybe there aren't two adults there pushing each other for healthcare. Mm-hmm. It is a gigantic problem. We have entities like Jackson or CHI that are out there trying to provide care. But for the most part, I have friends that are black, all right, and people of color, and they just don't believe like I believe, which is you have to go take care of that. Yeah. And we had a gentleman that worked here. He didn't want to go to the dentist. I sent him to the dentist. The dentist says, I think there's a problem. Mm-hmm. It took us a year to convince him to go get some care. Ultimately, they took out all of this because he was afraid of the system, didn't understand how it worked. He didn't have somebody holding his hand and taking him from one step to the next.
Yeah. So here's what it is. For some people, you'll be surprised. Many people would be surprised to learn that some people don't go to the doctor just because they cannot afford the copay, whether it's $20 or $30. That's a travesty in our country. So people die because they're not able to see a doctor at least once a year, their primary care doctor. That's a travesty. We can do better than that. So you've heard the term before that many of us think that healthcare is a human right, and all of us can contribute to ensuring that the most vulnerable can see a doctor as well. They don't have to sit in front of the emergency room for 3-4 days or 7 days. So we need to be able to assist them.
And we do a lot of shows with not-for-profits, and I understand there's care. And part of it is, though, who's going to take them by their hand and say, it's okay, I'll go with you over there. And I see that frequently, that they're afraid to access it. It could be for money or fear. A lot of people, especially men, don't like to go to the doctors, all right? And I want to do a pitch for make sure listen, if you're over the age of 50, make sure you get a PSA, especially if you're a person of color, because it's more apt to happen to an African-American than it is to an Anglo. I'm writing a book called What Comes After Survival, and I've interviewed a lot of men with prostate cancer. Mm-hmm. And the number one thing is they're afraid to talk about it.
Yeah, they're afraid to talk about it.
And that means they're afraid to talk about it before, during it, and after. Yeah. So what do we do to make sure, or best we can, that people can have access to quality health care?
Well, let me take my hats off to those free clinics that are out there, the FQHCs, and also the neighborhood clinics, that nonprofits that are assisting families. I volunteer at one of them in Little Haiti, the Center for Haitian Studies. They partner with UM and Jackson. They do good work. The last 3 years, I've been a volunteer at that clinic because, and they've seen not just Haitian American, they've seen Ukrainians, Cubans, everybody that comes to the door, and mainly supported by a physician who's a little better off, and then decided to go give back to the community. So if you can help me with the question again.
What do we do so we can help make sure that people can get quality health care?
What we have to do is that, just like other major economically viable nations in the world, in Europe and other places, the federal government has to make healthcare a human rights issue. They need to find a way to fund healthcare, and provide assistance to everybody, including expanding Medicare to elderly individuals.
See, and
how do you fund that? Honestly, I think we all who believe in giving back should be able to give a little portion, especially those who are the wealthiest in our country. I guess somebody's a trillionaire in this country right now. So what do you do with $1 trillion?
And one of the things we recognize is that there's the South Miami Children's Center right around the corner. Dr. Tina Carroll Scott used to be a pediatrician in Bal Harbor 17 years ago. She said, I'm going to go back to the community that needs me. And she provides health care from the whole family. That's one of the things that I learned. They go in with the children. Mm-hmm. But it's a family unit. Mm-hmm. So when you're taking care of mom or the baby, and you're taking care of the mom at the same time, I've seen what kind of work she does. And one of the things she had to do, because some funding got cut to that point, mm-hmm. so she had to work hard and go out and get some money from some other funding sources. Eventually, it starts from somebody's pocket, whether it's in Washington or the state. We have a lot of billionaires that are here in Miami. Come on, guys, step up.
Yeah.
All right.
Yeah.
And I know
Senator Soto used to say, we have plenty of money in Miami.
Yes.
So, and it's out there, and more today than in the past. Yeah.
We know there's people who've given a lot of money to the hospitals, and that's wonderful. Mm-hmm. And one of the things we also recognize, if somebody doesn't get health care checkups, they're going to wind up in an emergency room. And you know what? Then the cost is going to be 4, 5, 6, 10 times as much.
I know some people that live in European countries, in some European countries, they incentivize them for seeing their primary doctors. If you get your bi-yearly or yearly checkup and stay away from the emergency room, you get points. You receive points. All right. So if you take care of yourself, your doctors or your healthcare professionals provide you with a plan of how to eat, how to exercise, okay? And you do those things, you have points. So there are many ways of assisting people who wants to live better. It's part of it is education. I'm not an expert in the field, but I know what makes sense. And what makes sense is that if we just emulate what other countries are doing, and where people are able to live longer than we are, though we are wealthier than they are, we can emulate that. We don't have to be rocket scientists to understand that.
So I know there's a lot of changes that are going on in Washington and in Tallahassee, but if there was something you could do specifically, what magic button would you push, and what was the result that you'd want to happen in the healthcare arena first?
Healthcare arena?
Yes.
Ensuring that we expand ACA, what we call Obamacare, or we provide the vast majority of people in this community or in the United States that currently don't have access to healthcare and opportunity to do so.
And the reason so many people joined Obamacare because they could and they had the money to do it. So now there were millions of people that are now not there.
Yeah. Yeah.
They're going to wind up in the emergency room. That's just the way that stuff works.
You can say whatever you want if you don't like the plan, right? But look at the vast majority of people that have joined, both Democrat, Republicans, and independent and non-affiliate, whatever you want to call them. But if you want to fix it, come back with something better.
Yes.
Otherwise, leave it alone. That's just common sense.
The greatest thing of this time of the decade is that we have these elections that are coming up.
Yeah.
And that's where people get more hopeful and they get aspirational. So I'm so glad that you've done that, because you can make a difference.
Thank you.
And you served Dade Countyans for at least 12 years.
12 years, yes.
Plus you're doing some other stuff. So let's hear about some of that other stuff.
I served on the city council in North Miami for 3 years before I became a county commissioner. And honestly, I call myself a professional helper because I'm so grateful for what this community has done for me. You know, and I'm relatively successful right now, right? I'm, it's not about how much money you have in the bank, but I was able to have access to a good education. I have a stable family. I want to help people to benefit from these opportunities that this community gave me. And every child should have the same opportunity. Every child should have doors open up for them in front of them. So I think we can do. And honestly, it's not just for, we have another issue that we have not tapped into. I'm Haitian American. Actually, I may be the only person in the race that was not born in this country. So I'm an immigrant. So right now, human rights and civil rights are, that's a topic that's in danger. Okay? So you cannot have a country like this, okay, who was basically a country where people want to risk their lives to come to in order to benefit from our civil rights, the thing that's the most important of the forefathers of this country. And now we're trying to strip people away of that. So civil rights and human rights, we have to be in Congress to fight for these two fundamental rights.
When I was young and Cubans started coming to Miami, I said, I was pretty young, and I said, how could they come over here? And in a year, it looks like they own banks and they own duplexes. Okay. How is that?
That's the story of this country.
Yes, yes, that's the point. And and he said, I remember him saying, when people come here, they're driven. They want something better. They're not born. And he gave me a stern look. They're not born with a silver spoon in their mouth as he stared me down.
Look at it this way. Like I like to tell people my story because my story, I tell it for the many people that have a better story, or one like mine that don't have an opportunity, that's not sitting in front of Michael Miller to tell that story. All right. But this is so many people's story. We came here. We didn't just take advantage of the system. we give probably more back to the system. And that's the American dream. So we need to be able to appreciate people that come here, work hard, play by the rules, and give back to their community. That's what we know was.
So because I used to be around hospitals a lot, and I know people that are still in the industry, I see there seem to be a good percentage of healthcare workers are Haitian Americans. Oh. It's like, what is the attraction to that?
Well,
explain that to me.
I don't have the numbers with me, but I think I can find them and send them to you. Especially with if Haitian Americans and Black nurses in general and brown nurses were to leave the healthcare industry right now, our hospital system, our healthcare system would collapse. Okay, we won't have hospitality industry. People,
is that all going to get impacted?
Oh yeah, oh yeah.
Oh my goodness.
You know, immigrants have contributed so much, especially in South Florida, to the community here. Not just here, but we know about this community better than other communities. So the hospitality industry, restaurants and hotels would be affected. Hospital would be affected. You know, just like a friend of mine told me the other day, who do you think changed the bed for all these elderlies at the nursing homes? Who cleaned them up? Who mopped the floor at the hotel or the restaurant, as I used to do when I was in high school here? I was mopping the floor at Krispy Kreme after I leave school at 2:30. I went to my night job at 4
Thank goodness you can still remember.
Of course, that's my story. I should never forget it.
Yes.
And many of us from the immigrant community, we don't forget that. So who do you think is cooking in that restaurant at the hotel or and washing those dishes? Mostly, a large majority of them are immigrants, families and individuals. So we don't have these people here right now. Oh my God. We're thinking how costly this economy is right now.
I can tell you that the workers on roofs, they used to get $250 a day.
Yeah.
$450 a day now.
Yeah.
We pay that.
Yeah.
And that roof,
wow.
right?
Wow.
So imagine what that is per day, the guys up on the roof. And the employers are having a tough time getting people to do that.
Exactly.
And so we see that change. It's massive. We see that change. And maybe there'll be some changes. I hope that you can help bring some sanity back to Miami-Dade County. Forget everywhere else. If we can focus on South Florida, all right, we can do pretty well. This
is my hope and this is my dream. And I love this community. This community has been very good to me. I cannot sit back, like we say in French, on my laurels and just not give back what this community is giving to me. Sometimes I think I should take a break. Then I realize that on issues as that decided by the Supreme Court last Thursday, no, I need to keep fighting.
Yes.
I need to keep fighting.
Sometimes when you fight for those things and you don't think you make a difference, you do. So even if it doesn't get done, you might inspire some young person to go, I can do that. It's not happening today. There's a young man, Clinton John. I don't know if you know him, 14-year-old phenom. The kid is like crazy, beautiful. He comes down and he interviews people. He gets the same people we struggle to get. Yeah. No, they're afraid not to call him back. No, we're going to go down. And I've seen him do that work. And I asked him, when did you know? And he knew what I was saying. He said, when I was 9, I knew that I had something special. He said, when I watch him work, it's in 10th grade or whatever, and I see that. And he happens to be Haitian. His mother's Haitian, maybe his father. And I see the drive that he has. And when I see young Haitians, I go, we're in good hands. I see that all the time. And we know when there's a development that's bad, you know what makes a difference? When Haitian Americans start moving into it. That's going to make the difference because,
thank you.
Yes, those are absolutes. And we see that year after year.
Thank you.
So do we still call you commissioner? Hope to call you what?
Call me Jean. Call me.
Don't call me late for dinner.
People call me commissioner. They call, but at the end of the day, I'm Jean Monestime. I'm a product of this community. I still want to remain true to my community. Yeah.
Some people want to know, I know you have mentors and people that have helped you along your way. Some people want to know who some of those folks are. So what we're going to do, you're going to look right in this camera right there. And why don't you talk to them?
Well, I don't want to start naming names because it's so many of them. It's so many of them, both in the community and also at the church where I started. But there is one person that everybody can forgive me for mentioning his name. He's a former pastor of my church, Dr. Michel Porcina. He was a school principal in New York. He came here in the 80s to pastor my church because he was a minister first, but he has a PhD in education. And one night, I couldn't pay for college. I was driving a cab. He saw me at church on a weekday, and he said, it's church day, it's church night, but it's a Wednesday. What are you doing here? You're 20-something, you're supposed to be in school. And I say, well, I couldn't pay for this semester. And he called me back and said, you know what? I want to see you in my office tomorrow. I need to help you get back to school. And I was able, we're still so close. He's retired at least 20 years ago. And I love him so much. And this is somebody I will always be reminded of. And that's the kind of person I want to be to every young man or woman in this community.
Jean Monestime, thank you so much for your time. Appreciate it.
Michael.
And let's look at this camera right over here. And my brother Grant and I subscribe to the Disney rule, which is when you hug someone, don't stop until they do. Thanks for joining us and have a great day. Bye now.
Thank you, sir.